Hello, it's Dr. Rhonda Johnson. Today is Monday, August 24th, 2021. And today I'm going to be talking about the unvaccinated. Just who are these unvaccinated folks? You know, the answers may surprise you, but I'll give you a hint. For the most part, these are not people who are strongly opinionated. They're not anti-vaxxers or people who burn masks at public rallies. The majority of them are ordinary people, everyday ordinary people. So I want to go into this topic a little bit in more detail. We've all heard about Generation Z. These are young people born between 1996 and 2010. These folks are vaccinated at very low rates unless mandated to do so, for example, by their colleges or universities. So there's a lot of Generation Z who we need to try to get vaccinated, but they're not the only ones. Why do you think most hospitals and healthcare systems are mandating COVID vaccinations? Because, folks, there are many healthcare workers who are not vaccinated. And across the United States, some healthcare systems estimate that anywhere between 30 to 50% of their workforce were unvaccinated. And folks, that includes nurses, other healthcare professional people, including some doctors, technicians. They were unvaccinated before they were mandated to do so. Then there are the first responders, police officers. In some localities, 40% of first responders and police department staff are unvaccinated. Then there's another group, the school system employees. Again, estimates vary, but in some school districts, 40% of these school employees are unvaccinated. Then there are another large group of folks who have only had one shot of either their 2 doses of Pfizer or Moderna vaccines. And these one-shot folks, when they're supposed to have 2, they're inadequately protected. So if this applies to you and you only got 1 shot and you were supposed to get 2, please know that you are not fully protected and get vaccinated. Then there are the groups that are on the news a lot, the white Republicans and the white evangelicals, and the folks that live in these 11 states where less than 50% of the total population has received even 1 dose of a COVID vaccine as of August 17th. And these folks live in Idaho, Wyoming, Mississippi, West Virginia, Alabama, North Dakota, Louisiana, Tennessee, Georgia, Indiana, and South Carolina. And for some of these states, COVID infections are really surging. Then there are Black and Hispanic people. Although new data shows that in 5 states with exploding Delta variant infections, Alabama, Florida, Louisiana, Mississippi, and Missouri, Black and Latin people are getting vaccinated more rapidly now than white people. Then there's the group that had COVID, and I've heard this from a lot of folks who have had COVID. They think they're protected because they have so-called natural immunity from their COVID infection. However, the experts keep telling us, don't rely on natural immunity to protect you, as the Delta variant is breaking through all kinds of immunity, including the vaccine-induced immunity. Then there are the babies and the children and the people who are allergic to components of the vaccine or who have diseases that are so complicated that they can't get vaccinated. So my advice to all remains, if you're eligible to get vaccinated, whatever group you belong to, if you're eligible, get vaccinated. I realize many people have so many reasons why they remain unvaccinated. I talk to a lot of folks and have done education, and people have a lot of reasons why they're not vaccinated. But one reason was removed from the list today. Folks, I know you've heard about it, The Pfizer vaccine is now fully approved by the FDA and is no longer considered approved under emergency use authorization. Now, I suspect the Moderna vaccine will soon follow, and there's no indications yet about the Johnson & Johnson vaccine. So everybody who's in the unvaccinated and the vaccinated group, one thing we know for sure, COVID is doing what it did before, making people sick, a lot of people sick, and killing lots of people. People will lose their jobs, people have lost wages, kids have been kept out of school. It continues to create chaos. You know, my physician and nursing colleagues tell me stories about patients who are in the ICU who have to go on a ventilator, or they're getting worse and worse from their COVID infection. And they are just begging to be vaccinated, asking if the vaccine will help them to stay off the ventilator or could save their lives. But folks, when you get that sick, it's too late. The vaccine can't help you. You need to get 2 shots, or you need to get the 1-dose Johnson & Johnson vaccine. It takes at least 2 weeks to be fully effective after your last dose. Now, I want to keep it real. The vaccine is not a magic force shield. You still have to wear your mask, distance, and wash your hands. We have to take this layered approach because the viruses are just out there waiting to infect us with our next breath. And now, if you need one more reason to get vaccinated, have no illusions. Our society here in the U.S. is moving to mandatory vaccination and proof of vaccination. Many jobs are going to require it. The Pentagon, for example, just today mandated COVID vaccines to all Department of Defense personnel. And pretty soon, in some areas, you have to show vaccination proof to get in a restaurant and to go to some events. You know, society has had enough of this pandemic. There's far too many people getting sick. There's so many people dying, and there are not enough hospital staff to take care of the sick in a lot of places. You know, I looked at statistics. On June 20th here in the United States this year, 2021, there were only 2,300 some newly reported COVID cases, and 33 people lost their lives. But yesterday, just 2 months later, there were almost 69,000 people who tested positive and over 1,500 people who died yesterday. Folks, don't wait till it's too late. Get the shot. It's no big deal. It's safe and it works. That's my message today. As always, my views are my own. Stay safe and have a blessed day.